Hello, good day. So, for this day, I'm going to discuss nursing process in the care of population groups and community. Now, community is a group of people sharing common geographical boundaries. By geographical boundaries, it is also called as your physical boundary, and it is one of the most obvious type of boundaries. By physical boundary, it is a naturally occurring barrier between two areas, okay? So, in a community, okay, since these people share a common geographical boundaries, these people share common values, common interests within a specific social system. So, as a nurse, you use the assessment data to come up with your community health nursing diagnosis, and it will become the basis for developing and implementing community health nursing interventions and strategies. So this is very important in CHN. We have the types of community diagnosis. Okay, common types. We have the comprehensive community diagnosis and the problem-oriented community diagnosis. Your comprehensive community diagnosis is a general information, okay, about the community with the intent of determining not only the present, okay, or prevalent health conditions and risk factors, but also the socioeconomic conditions, the lifestyle behaviors, and the attitudes that have effect on health. We also have a problem-oriented community diagnosis that is specific, okay, specific type of assessment that responds to a particular need of a target group. Okay, when we say a target group, pwede katong mga bata, pwede mga mama, pwede mga geriatric population nato sa isa ka community. Okay, example ani niya ang mga health problems related to, for example, improper factory waste disposal. Now, we have determinants of community comprehensive diagnosis under the demographic variables. So, under your demographic variables, we have the total population and the geographical distribution, including the urban-rural index and the population density. When we say urban-rural index, it's a comparison of the population between your um, urban population and the rural population. So katong mga tao or population nga nagpuyo sa urban areas compared sa mga tao nga nagpuyo sa rural areas or bukid-bukid nga mga areas. So as we know, the population of the urban location is mas daghan ang mga tao compared sa land area nila. Whereas, ang katong nasa rural places is mas dako ang ilahang land area over sa ilahang population. Okay? Now, your population density is, okay, and it is a key geographical term. Your age and sex composition, so, kung under infant, okay, pila edad, uh, ang age group niya, male or female ba. We have selected vital indicators such as the growth rate, crude birth rate, and crude death rate, and life expectancy at birth. So, ang kaning mga growth rate nimo is kung unsa kataas ang imuhang population or increase or change sa imong population over a specific time. So, lahi-lahi nga mga countries, lahi-lahi og growth rate, lahi-lahi nga mga countries or mga year, lahi-lahi pa sila og growth rate. So, imuhang crude birth rate is the total number of live births in a specific location um, over the population in a specific time times 100,000. Okay, also pareha po na siya sa death rate nga total number of deaths, okay, over total population times 100,000 gihapon, and your life expectancy at birth. So we have the patterns of migration. We have the terms migrants, immigrants, it starts in I. Ang mga immigrants nimo is gikan sa laing lugar padulong sa inyong lugar. Okay, pasulod sila sa inyong lugar. Okay, mo na siya ang mga immigrants. Okay, that starts in I. Ang immigrants nga nag-start og E, mo to silang mga tao nga gikan sa inyong lugar nga mangadto sa laing lugar or pagawa sa inyong countries. Okay? So, we identify the patterns of migration and the population projections. Your population projections is kung pila ang expected nga change sa population sa isa ka tuig. Okay? Or sa sunod ka tuig. So that is your population projections kung ning taas ba siya or ning ubos or kung normal or kung same lang ba sa previous. Another variable of determinants of community diagnosis is your socioeconomic and cultural variable. So, under social indicators, we have the communication network. Your communication network may be formal or pwede po siya informal, and it is necessary for the dissemination of health information. So, as nurses or student nurses, kinahanglan nga ang ato ang i-disseminate ng health information is valid siya, it is a fact, and it must come from a reliable source. So, your communication network also facilitates referral of clients to the healthcare system. So, ingon ani na siya ang pag-refer sa isa ka client sa community. So, gikan sana assess nimo or if you are a nurse nga nasa community dili ka mo diretso sa imuhang hospital pag-refer dito na siya sistema ana. So first is moadto na siya sa ilahang barangay health station. Okay, your patient will go to your barangay health station. If sa barangay health station um, mahatagan na siya og let's say first aid or per merong panlunas, pwede dito na siya mo end. But if dili makaya sa barangay health station, then the barangay health station will give a referral note. Okay, isa na siya ka-form indicating the patient's condition na ihatag dito sa ato ang referral unit. After sa imuhang barangay health station, i-refer na siya dito sa uh, city health office or sa municipal health office. If for example, um, parehaan ng kanang mga napaka ng iro. Okay? So, pwede kang maato sa BHS daan, mga kaog referral. Okay? So, from your BHS, maato ka sa City Health Office or sa Municipal Health Office para matagan ka og tambal sa pinaakan sa iro or ma-vaccinate ka for anti-rabies. Okay? Manang moingon ang mga workers sa imuhang CHO or sa MHO nga mga na sila referral from the barangay. Okay? So, if dili makay ni City Health Office or Municipal Health Office, madto siya sa um, referral hospital. Okay, for example, in Osamis, our referral hospital is public referral hospital is your Mars Medical Center. Okay, if dili makaya i-manage ni Mars Medical Center ang imuhang clients, then moadto na mo sa mas taas pang referral unit, which is your um, regional medical center. Ang ato ang regional medical center dinhi sa Northern Mindanao is your NMMC, your Northern Mindanao Medical Center that is located in Cagayan de Oro. Okay? If dili pod makaya i-manage ni NMMC ang imong patient, madto ta sa PGH, okay? Or maadto ba kada sa SPPMC, okay, in Davao. So mo na siya ang referral system sa public-based lang. Okay? Although pwede po ta moadto sa mga private, okay, private hospitals for your referrals. Pwede po na siya. Next is the transportation system, including road networks necessary for the accessibility of people to healthcare delivery system. So another social indicator is education level, which may be indicative of poverty and may reflect in the health perception and utilization of pattern in the community. Okay. So katong mga patient nato sa community nga wala kaayo naka-attain o kanang, let's say, kanang wala sila nag-eskwela, so usahay no nga dili sila mahatagan og insakto nga health information or na sila ipagtuo nga ilaha regarding sa health or sa health condition sa ilahang family. So we also have the housing conditions which may suggest health hazards. Okay? Congested ra kaayo, daghan ra kayang namuyo sa isa ka balay, or hazard siya for fire and exposure to elements. Under your economic indicators, we have the poverty level income. Okay? A level of income, okay, mingon tag taas ang or the level of income that is above is possible to achieve an adequate standard of living. And kung ubos ana niya, mo na siya yung makaingon ta nga na sa poverty level ang isa ka family or sa community. Okay? Dili enough ang resources nga naa niya or income nga naa niya sa pag supply og adequate needs para sa iyang family. So, namo sa poverty line if ingon ana ang situation sa inyong community or sa inyong family. Another indicator is the unemployment and the underemployment rates. So, unemployment, wala yung trabaho, and your underemployment occurs when a person does not work full-time or naa siya'y work pero it does not reflect their actual training or financial needs. Okay? Dili enough ang iyang makita or iyang sahod sa kung unsay actual niya nga training or education or skills. Okay, mo na siya sa underemployment. So, your portion of salaries and wage earners to total economically active population, when we say economically active population, this comprises all persons of either sex who furnish or supply labor for the production of economic goods and services. Okay? So, in number 4, we have the types of industry present in the community. So, industry, as defined in macroeconomics, is an industry or is a branch of an economy that produces a closely related set of raw materials, goods, and services. Okay? We have the occupation common in the community. So, um, kung it refers to the occupation nga kasagaran sa isa ka community. So, sa number 4, so the type of industry present sa isa ka community, for example, in Misamis Occidental, since it is a cocoa-based province, so natay mga major manufacturing firms or industries in our province that is engaged in the production of mga crude coconut oil, mga cooking oil, so anything that is coconut related. So, other also industries that is present in Misamis Occidental is we have the furniture products, we have the ceramics, okay, we have processed foods, okay, and other marine products. fourth step is the collection of the data or collecting the data. Now, there are different methods to collect the data, one of which is the observation method. So, in the observation method, you get the information by observing the behavior and the environment uh, of your subject population. Okay? And in observation, example ana niya is ang ocular survey. Okay? By the way, your observation is a useful method of collecting data when the informants are unavailable to directly supply information or may likely give inaccurate information sa imuha. Example ng observation is your ocular survey or your windshield survey. So, it is an approach to perform um, it is an approach to perform rapid appraisal of the community. So, unsay buhaton sa imong ocular survey, maglibot-libot lang ka, okay, walk around the community, appreciating what can be seen and perceived as the people go along with their daily lives. Okay, so participant observation is practiced by the nurse by living with the community of their study. Now, next to that, or um, another example another method in collecting data is your records review. So, unsa ning records review? So, katong mga recorded health information sa isa ka population, i-review lang to siya nimo, okay? You obtain data by reviewing folders, files, or books compiled by health or non-health agencies from the government or other sources. So, from the government, we can get this information from the Department of Health or sa local civil registrar's office. And another method is the interview. So, ang katong sa observation kaganina is dili necessary nga makig-istorya ka sa mga patient. Okay? Observe lang ka kung sa imong nakita. Okay, ocular survey lang. Then sa interview, it involves asking and answering questions following a systematic procedure. So its aim is to gather first-hand information sa imuhang subject of inquiry. Okay? Primary information or first-hand information na ang imong makuha sa imong interview. Now, there are ways of conducting an interview. We have the face-to-face interview. Okay, it's conducted in person. Maginatubangay mo. We have the telephone interview. Okay, your telephone interview is of course via telephone. Okay, or pwede pod karon virtual interview. Okay, kung na internet connection. We have the key informant interview. Okay, when a person known to be an expert or an authority on specific subject that is interviewed. Okay, for example, ang mga kauban nila sa balay. Okay? Mao na siya ang isa sa mga key informant kung um, magkuha ka og data. Okay? Kauban sa balay, mama, papa, mga igsuon. Okay? Those are your key informants. We have the individual interview. It takes place between a respondent and the interviewer. Okay? So, kung namo i-discuss ng mga sensitive issues, so mo na siya ang mas reliable, okay, or mas convenient nga gamiton or method sa pag-obtain og data ang individual interview. We also have a group interview. Okay, the interviewer plus another several participants, usually around 10 to 15 persons. Okay, or pwede more than 2 ang group interview. So, ang pag this allows the interviewer to obtain data from a good number of people at the same time. Thus, it will save time and it will also save effort. So, di na kakinahanglan magkanda kog individual interview kay naa naman sa isa ka location at the same time ma-interview nimo ang pipila ka mga tawo. Next, we have the types of interview. We have the structured interview and the unstructured interview. So, sa structured interview nimo is na nakagiandam daan nga script. Okay, or mga list of questions nga dapat nimong i-ask sa imuhang responder. Okay, we have the unstructured interview. So, um, kuan lang, let's say, wala kay necessary nga script. Okay? Kung unsa lang tong imuhang mapangutana sa imuhang interviewee or sa imuhang respondent, mo na to siya. Okay, that is for your unstructured review. We have the focus group discussion. Okay, unsa ang focus group discussion? Its aim is to obtain or elicit and explore opinions of people and determine their attitudes and practice regarding limited set of concepts. Okay, so ang mga participants sa imong focus group discussion is selected based on the variables that are being studied. Okay, so unsa ni nga mga characteristics nga atoang iset sa participant sa imuhang focus group discussions, uh, kung naa sila common characteristics, if they have characteristics that will differentiate them from the other. So, example ani niya is in determining the factors of the child feeding practice in the community. Kay kinsa ato ang pangutan-on is ang mama or ang child care providers. Now, we have developing an instrument. So, ang kaning mga instruments ni mo ni siya ang mga questionnaires nga imuhang gamiton or ang script nga imuhang gamiton in conducting your interview. Now, in developing the instrument, so this instrument or tools facilitate the nurse's data gathering activities and it varies in accordance of its use. So, we have a survey questionnaires. We have survey questionnaire. It's the form one uses to document the data collected. So, ang imuhang survey questionnaire, ang imong respondent ang mag-answer. Okay? So, we have different types of survey questionnaire. We have the interview. Okay? Ang interviewer schedule or ang interviewer, ihang basahon ang question and record respondents' reply to the questions. Okay? Or sometimes pod na pagitawag nga self-completed or self-administered questionnaire. So, ang imong respondent sila ang mubasa, sila ang mo-answer sa ilahang mga responses. Now, we have a focus group discussion guide. So, since natay focus group discussion, so ang kaning guide nato, it serves to facilitate the direction and flow of exchange in ideas, specific topics or concepts among the participants. Okay? So, dili necessary nga mo sundon yun tong focus group discussion guide. Okay? Um, pero, dili siya necessary nga i-follow, pero we must make sure nga all concepts are discussed. Okay, sa focus group discussion guide. Okay, we also have the key informant interview guide. So, same ra gihapon sa survey questionnaire. So, it helps give direction to the person doing the interview using a set of prepared questions on a specific subject. Okay, so pareha siya sa katong survey form nga to ang gihimo. So, observation checklist. Okay, so makalist na daan didto ang possible nga manifestations or indicators of a problem, then igo na lang ka mag-check. Okay, if it is present or not. Now, next to that is your actual data gathering. So, kung humana kag-formulate sa imuhang tools, humana kag-identify sa imuhang population groups nga i-kandakan og interview, we have the actual data gathering na dayon. So, we have the pre-testing of the instruments. Okay, it is highly recommended. And dapat ang katong data collectors must be given an orientation and training on how they are going to use the instruments on data gathering. So, i-check daan. It is necessary to check and fill the filled up instruments if information gathered were complete, accurate, and reliable. So, para walay mga data gaps or unreliable um, unreliable nga mga portion sa imuhang gigamit nga tool or instruments. Next to that is the data collection. So, in data collection, the nurse and the team are putting together all facts and figures to generate information about the health status of the community. So, ang data nga nakuha or generated, pwede siyang numerical or descriptive. When we say numerical, it involves numbers that can be counted, and for your descriptive, these are the ones that can be described or can reveal the quality or characteristics of observable facts. In your data collection, you determine the data. Okay? Descriptive or numerical. Your descriptive, again, it can be described. Okay? It is qualitative, and your numerical is quantitative in nature. Okay? Now, you categorize the responses or the data in the data collection. Okay? So, you should take note nga your open-ended questions do not provide choices or categories, but the nurse can still facilitate the collection by constructing categories from their answers. Okay? So, open-ended questions, dili siya yes or no questions. Okay, pwede nga ma-explain further sa imong respondent ang ilahang answer. Okay, pinaagi sa ilahang open or pinaagi sa imuhang in the previous slide, we have provided a question that is unsay mga reasons kanang dili magpa-breastfeed ang isa ka mother. Now, here are some breast responses sa mga na-interview. So, after getting the responses from the different uh, people or the age group, we can categorize them as, for example, for the convenience, medical, personal, and economic um, categories. So, we categorize them depende sa ilahang mga responses. Now, data collection, we are to summarize the data. After collecting it, we are to summarize the data. We tally the responses, okay, manually or sometimes using a computer. Okay, so we have the categories of data collection. We have the mutually exclusive and exhaustive categories. So, ang mutually exclusive choices do not overlap. Okay? So, pwede siya magamit sa numerical and descriptive data. Ang exhaustive categories, these anticipate all possible answers that the respondent may give. Okay? So, daghan siyag mga possible answers nga pwedeng gamitin. For example, in the case of family planning method, we have the natural and the artificial. Under your natural family planning method, we have your LAM, we have your BBT, we have cervical mucus method, symptothermal, standard days, and others. We also have for the artificial, we have the use of IUD pills, injectables, condoms, and others. We have your permanent family planning method that is permanent. We have tubal ligation and the vasectomy. So we have a fix. We have the ways on categorizing responses. We have fixed response data and the data from open-ended questions. Your fixed response data is ang respondents, igo na lang sila mag-choose. Okay? Magpili na lang sila based kung unsay nakasulat sa imuhang questionnaire. Okay? So, naputay data from open-ended questions. These are constructed from responses in randomly selected questionnaires. What are the ways in summarizing the data? We tally manually or with the use of computer. Okay? We have different or natay daghan nga mga tallying softwares, okay, nga maggamit in summarizing our data. We have the IPINFO software. It is used by the CDC in Atlanta, Georgia. Now, next to that is your data presentation. Okay, so in data presentation, it depends on the type of data obtained and depende pod siya kung unsa nga klase nga method ang gigamit. Okay? So, for example, if you use a descriptive data, so narrative po ang report ng imong ihatag. So, kung numerical data, okay, it must come in numbers. Okay, numerical data are presented into tables or graphs. Okay, pwede ta magamit og line graph, bar graph, histogram. Okay, so proportional or component pie graph, or we call that as our pie chart, and we have the scattered direct diagram. So we have here the definitions of the different methods and how to present your numerical data. So we have the use of tables. Okay, so it provides a compact way of presenting large sets of detailed information, and dali na tong ma-compare if we use the tables. So we have the pointers in constructing a table. So dapat uniform siya. Okay, dapat limpyo siya lang tawon, dili gagmay, sakto lang iyang kadakon. Okay? So, dapat direct siya. Kung unsa lang tong necessary nga information nga dapat ibutang, mora po ibutang. Okay? And the positioning of the table, okay, should be placed immediately after the text where it is cited. Okay? So, dapat uniform, and every table must be self-explanatory. Okay, we have here examples of your methods on how to present numerical data. We have a line graph. Okay, we have here two. Okay, two variables nga to ang gi-check. Okay, we also have the legend here and the different axes, the x and the y axis of our data. So this is your bar graph. Okay, it compares, okay, counts and rates between the categories that is identified. Okay, we have here a histogram or a frequency polygon. So, dinhi na to, or magamit tawag histogram if not a frequency distribution or measurement. Okay, so para sa mga continuous or mga interval data, we also have a proportional or component bar, or this one is also called as your pie chart. So it shows a percentage or breakdown of a group or total where the number of categories is not too many. Okay, dali ta makagamit og pie chart if our categories dili siya daghan. If daghan is maglisod ta kay gagmay na lang kayo ang space that is allocated for the categories that is being identified or the categories that are identified. We also have a scatter diagram. So usually kuan na siya masyag mga dots, okay, sa isa ka we have the values and the x values. Okay, for scientific analysis ning ato ang scatter diagram. Okay, so we have some pointers here for graphical presentations. Dapat self-explanatory. It should be properly labeled para makabalot ta kung unsa ato ang gi-identify nga mga data. Okay, and the trend lines and curves should be properly identified by labels and legend. Dapat neat. Okay, it should be simple. Okay, your vertical scale should start with 0. Okay, dayon, and distance between scales must also be observed. Okay, but after the presentation of your data, we have data analysis. So all the data that were gathered are sorted and classified in terms of its relatedness and interpreted for any significance or implication. So, dinhit ta maka-identify sa atong trends and patterns of health needs and problems in the community. So, um, ang katong magnitude and extent sa atuang na-identify nga mga problems and their implications, we compare that to the standard values or the norms. Okay, so we have the problem tree analysis approach, we have the cause and effect of the health problems. Okay, that is for your data analysis. Next, we have identifying the community health nursing problems. So, if humananata o gather sa data, humanatag analyze, okay, we can now identify the CHN problems. Okay, so humananata ani categories of the community health problems, pwede siyang health status, health resource, or health-related problems. We have your priority setting, katong na yung mga number based on the nature and the condition of the problem presented. So this is a standard table nga itong gamit in prioritizing the different health problems. We have five, okay, and it has its criteria and the weight. Now, here are the factors considered in scoring preventive potential. Okay, gravity, okay, duration, the current management and exposure of any vulnerable or high risk groups.